So, good evening, everybody. Meeting again and happy to see you all over there. Good evening,
Good evening,
Ali.
sir.
Good evening, everyone. Good evening, Pallavi. So, we are discussing the sixth edition of Organon of Medicine right from its introduction. Everything we have discussed. We have started with the James Krauss Introduction. We have learned first the preface written by William Borick, and where we have learned the difference between fifth and sixth edition of Organon of Medicine. And in last two lectures, we were discussing James Krauss Introduction. Only two paragraphs up till now we have finished. And he explained over there that this manuscript of the Borick Hahnemann was in danger in two different wars. And it was only because of Borick we have the sixth edition of Organon of Medicine. So he was the person to whom we are in depth. This is what the James Krauss says. And they said, then he says, the four epochal figures in the history of medicine, the Hippocrates, the observer, the Galen, the disseminator, the third Paracelsus, who is called to be a assayer, and last one, the Hahnemann, the experimenter. And after that, he started explaining about what is the importance of diagnosis in general, and that aspect we were discussing. In fact, James Krauss is giving you every detail, every aspect. What is the importance of diagnosis? We generally keep it in our mind only one sentence. So diagnosis is not important in homeopathy. And in fact, this is very wrong. Unless and until we diagnose, we cannot go ahead. Yes, we can prescribe, but that prescription might be wrong if we never diagnose the thing. And that's why every aspect, why to diagnose, he has mentioned over there. Yesterday, we have learned few aspects of it. He explained over there that we diagnose first important thing, what is physiological and what is pathological first. This is too important to know. If it is physiological, there is no need to treat. But if it is pathological, there is a need to treat. And that is, this is the first important thing which is necessary for us to understand. Second important thing, with diagnosis, we exactly know what is the anatomic seat, where exactly disease lies. If it is in the, if patient is coming to you with pain in right iliac fossa, if we understand exactly what the pathology is there, what is the diagnosis, we can think about the prognosis, we can think about the prediction, we can think about the complications which can happen, and then accordingly we act. The ultimate management depends upon this, and this is too important for us. So the diagnosis, which he explains over there, plays a very vital role. Please keep your video on mute mode. Everyone. Yes. So diagnosis is important from different points of view. Then he explains that the basic thing, what is physiology and what is pathology. And all pathological process we must know. We must know the inflammation. We must know the exudation. We must know the infarction. We must know the infection. We must know the hypertrophy. We must know the hyperplasia. We must know the atrophy. All the aplasia, all those things which matters a lot in order to understand what pathological process runs. Accordingly, we can think about the miasm. So this is too important. So unless and until we understand this, this is not possible. So what he explains over there is the importance of diagnosis. The last sentence which we have learned was we diagnose the physiologic process, the what, that is the course of inflammations, exudations, degenerations, necrosis, atrophies, hypertrophies, aplasia, hyperplasias. This already we have discussed, and all those things matters a lot. My suggestion to all new homeopaths, budding homeopaths, you please go through your pathology, medicine, basic. This should be very thorough, very clear. Your understanding regarding this should be very clear. Then it is possible to understand patient and treat the patient properly. Then we can manage that patient properly. Without that, we cannot. And that's why this is too important to diagnose. Then he says, we diagnose the etiologic factor. Yes, this is too important. We diagnose the etiology. What is the cause? What what is the thing which causes the disease, etiological factor. We must understand what may be the possible thing because of which patient is in front of us. This is too important. The etiologic factor, the how, that is whether developmental, whether traumatic, whether infectious antecedents of predisposition and excitation. The 4 points which he explains over there matters a lot. Which are 4 points? First point, he explains whether it is developmental. If patient comes to you with a developmental problem, for example, if patient comes to you with a congenital heart disease, what do you think? Patient comes to you for homeopathic treatment. Yes, just today I have followed up a child who is having the patent ductus arteriosus, and she was nearly about 2 years, and they asked that it is necessary to operate her on the after 2 years, and the patient's relatives asked me whether is there role of homeopathy, and the patient was brought to me when she was 2 years old, because they have done all the investigations and everything. When she was 3 years old, they came to me. So they have done twice echocardiography, and every time they have told that we have to wait till she becomes 5 years of age, and then we can do a operative. And then on 3rd year, they brought this child to me. I started her treatment, explaining all pros and cons, and explained that it is possible, because I have treated one more case in the similar manner, and she was got treated completely, and there was no more operation required. So this case I have started handling 2 years back, and now she is 5 years old. In between, 4 echocardiography was done, and every time it was getting getting miniated day by day, and last echocardiography was done, and where there was absolutely healed patent ductus arteriosus. The cardiac surgeon who was there in SMBT hospital, he himself said that your child never requires now surgery. You must think, but if it is the Fallot's tetralogy with which patient approach, you must know that it is not possible. So what is, whether it is developmental? If a patient comes to you with a cleft palate, it is not, it is purely surgical condition. Accordingly, you have to think. That's why first important thing which is there is the etiological factor. And that etiological factor, the first point is developmental, whether etiology is developmental or congenital. Hahnemann says all congenital disorders with which patient borns, they are generally syphilitic miasm. They are the products of syphilitic miasm. So it indicates right from the birth, the child is carrying the syphilitic miasm. This is too important to understand. Accordingly, you have to think about remedy. Second important thing which he explains over there, second cause, etiological, it might be traumatic. Whether it is traumatic means whether it is because of external injury. If it is because of external injury, still you can treat. It depends what type of trauma it is. If it is a trauma which is producing absolutely a displaced fracture, then there is a role of surgery along with homeopathy. Then you have to join together both things, homeopathy along with the surgery. But if it is a trauma of a blunt variety with a hemorrhage, with a chemosis, with sometimes big hematoma, you can treat that patient with the help of homeopathy. But you must know what has happened. My one of the very close friends, he is also homeopath. He is practicing in Nasik. His very first friend got an accident, and the moment he got accident, he got the call to my friend, and immediately that fellow was shifted to one of the big institute in Nasik. And my friend, he called me, sir, this has happened. He had multiple fractures. It is very difficult to save him. Still, we can do a lot. He had a big head injury, and there might be a definitely chance there might be internal problems also. What can we do? I immediately said, you have, my dear friend, this remedy. You put 2 drops inside the mouth of that fellow before doing anything and give it as whenever it is possible. Thing was that this fellow was hospitalized for 6 months in that hospital, but he was lucky enough, after nearly about 10 to 15 operations, he survived, and now he's a big giant personality in Nasik. This has happened because we have we know the exactly what may be the cause. We diagnosed the cause, and we diagnosed, and accordingly we have acted. So I know it was the very important remedy is the arnica, that moment which bears that shock, that bears the vitality. So this is too important to know the trauma, whether it is traumatic. The third cause, which explains over there, whether it is infectious antecedents. What is an antecedents? Antecedents of predisposition. First word you have to understand is predisposition. Predisposition is nothing but the miasm, which is brought right from birth in you. Everyone carries the miasm. Myself is having miasm. All 3 miasms are hidden in all of us, but one might be dominating. So this is too important. We know the things. Only thing is that antecedents, what is the infectious antecedent of that specific predisposition? If I am sorry and some exciting cause happened, and all of a sudden I got sudden infection, and I got a sudden fever, that might be exciting cause, but already predisposition was there because of which I got ill or I got the illness. Without that, it is not possible. So first important thing, you have to understand what is the exciting cause. At the same time, you must know what is the predisposition, what is the dominating miasm. And fourth important point we explains is the excitation. That is nothing but the exciting cause, in specifically when the disease is acute one. And these are 4 important diagnoses which you have to do along with the regular diagnosis. From homeopathic perspective, you have to look for these 4, and which are very essential. So whenever you are writing the answer, the importance of diagnosis, all others are important, but from homeopathic point of view, these are 4 important measures which you have to look for the understanding the diagnosis. And these are etiological factors which you have to look for. This is what James Krauss says, and this is nothing but whatever is carried from the 291 aphorism. He is taking just a glimpse of it in order to explain to all of you. And last sentence he explains over there, we diagnose the therapeutic application at the end. After understanding the disease process, after understanding the human being, then we decide what to do. The therapeutic application depends upon that. Without that, it is not possible. Generally, what I have observed, many homeopaths never manages the cases. Many homeopaths, they are only the prescriber. What word he has used? The therapeutic application. It is not only giving a remedy to the patient. It contains many things, and that's why on my case paper at the end I have written homeopathic management. I have not written homeopathic medicine. Homeopathic management, because it is a therapeutic application where many things comes together, where the auxiliary measures comes, where the remedial agent comes. So all those things matters a lot when you apply the therapeutic, and it depends upon your diagnosis. And that's why he says we diagnose the therapeutic application, the end, that is the remedial treatment of the cure, for the cure, and palliation. Both things he has used. Either it is for the purpose of cure, or either it is for the purpose of palliation. Both are necessary. And why both are necessary? Because if patient is incurable state, you have understood the remedy which you are going to apply is either palliative, and if it is in the curative state, you can apply the curative. But this is for the allopaths. If a cancer in the end stage is there, they generally prescribe only palliative in the form of a morphine. They give the morphine to relieve the pain. They know that nothing can be done. And that's why they defines whether it is curable or incurable. Once they find it out incurable, they start palliative line of treatment. But homeopathic palliation is rather absolutely different. Homeopathic palliation depends upon the same remedy. You cannot differentiate. There is no line of demarcation whether it is incurable or curable. And that's why what Hahnemann says, when you do homeopathic palliation, you have to find it out the same remedy after whole case taking, and you have to give the same remedy to the patient. If patient is in a low susceptible state, give it in the LM potency in a repeated doses. If the remedy is right simillimum, and if patient is in a curable state, the same remedy will act as a curative. And if patient is in a incurable state, same remedy will act as a palliative. So there is no differentiation of application of whether it is palliative or curative. We have to find it out the same similipum when we use the homeopathic measures. But when we use the allopathic measures, the remedy changes. So importance of diagnosis is variable from allopathic point of view and from the homeopathic point of view. And last point, which he explains over there, we diagnose the therapeutic application, the end, that is the remedial treatment for cure and palliation, and the prophylactic treatment for hygiene and sanitation. See, this is very important. This measure we have to apply. Just now, there was the epidemic of COVID-19. And it was not the time where we used to give only a homeopathic remedy. It was the time where the hygiene was very important. It was the time where sanitation plays a very vital role. It was the time where you have to follow all the norms in order to avoid the spread of the disease. So when you think homeopathically, you don't think only giving the medicine. And this is what James Krauss wants to explain, that importance of diagnosis is always there from all perspective. And this paragraph, even though it looks very small, it has a lot meaning. My suggestion is that you go through it again and again, and that will make you a understanding that this is the theme which gives you a very specific understanding about the human being, a deceased human being. So we have learned a lot from this paragraph. We'll go ahead. The treatment of patients subject to malformation, malpositions, malnutrition, injuries, foreign bodies, traumatic and infectious inflammations, new formations is effected with medical, surgical, hygienic means or combination of all these in a given patient. So if the patient is coming to you, you have to first understand what the patient is suffering from, and the varieties of it he has explained. The patient might comes with the one situation, the malformation. There was a case with me, a case of hypoplastic uterus. She was the wife of one Chancy doctor, and she was brought to me. She was already taken to gynecologist or sterility specialist. They have done all the investigations, all the endocrinal things, measures, all those things, and they explained that you have to continue on hormones for nearly about 2-3 years, and then if the uterus develops, then you have chance to treat this lady, or you can get a chance of a baby. And they have told the cost of the treatment in lakhs, which was not possible for him. So that lady was brought to me. Her age was just 22, and both of them came to me and they asked, is there any role of homeopathy? It was the case of malformation. So I took the case and I have started with the homeopathic remedy accordingly, expecting that it will settle the problem. It will develop whatever is not properly developed. It was way back. In fact, I think it was 10 years back that lady was brought to me. And this I'm not explaining aphorism. This is James Krauss Introduction. James Krauss Introduction, page number 7 in my book. This is the page number 7, second paragraph, first line. So this lady, I have started with right remedy, with clear-cut constitutional treatment. And after giving that remedy, she got menses after 1 month, which were not there properly, only spotting once in a while was the history. She got the menses in next month. Next 2 months, she got very clear menses after 28 days. In the third month, and she found to be pregnant. Her UPT was positive, and we have done the USG after 1.5 months, and it was very clear cut pregnancy without any having problem, and she delivered in our hospital after 9 months with a normal delivery. So even though it was malformation at that time, it worked. But only thing is that if malformation is, whether it is curable or not curable, whether it requires surgical measure or whether it requires medicinal treatment, that you have to think. So first is malformation, second is malposition. Yes, malposition is again one important thing. And malposition you have to diagnose. Very important again. Number of times people overlooks the clinical examination. Clinical examination is very important because we generally, it has been observed that many homeopaths never clinically examine the patient. Even many doctors never examine the patient. This is what happens generally. Clinical examination plays very, very vital role. I had a case who was brought to me with severe asthmatic attack. He was a child, 7-8 years child, and he had a very severe asthmatic attack. I asked him to lie down. I examined, and there was air entry only on the right side. There was no air entry to the left side. I was shocked. How can it be possible? Then there were typical wheeze was going on. So no question of a bronchi, but it was only on right side. Left side is absolutely no entry. I have seen many prescriptions here seen by many physicians, many child specialists. No one have asked him to go for X-ray chest. Big question was there in my mind. Ask them, you have to go for one first chest X-ray, and then we'll do whatever we want to do. So I have started with asked him to go for X-ray chest, PAV, and after half an hour, they brought the X-ray where there was left lung totally collapsed. And it was mediastinum was totally shifted to the right side. To my surprise, he was treated 2 years by many people, and they never knows what is the problem. They were just prescribing bronchodilators. They were prescribing the steroids. They were prescribing the antibiotics without finding what may be the problem. This is too important for us. And that's why whenever any patient comes, those thoughts should be in your mind. And this is what he says over there. You have to find it out. Is there any malformation? Is there any malposition? Is there any question of malnutrition? Many times you get the cases with the severe edema on lower extremity in the old patients. And in old patients, whenever the edema is there, generally we think in the disease point of view. The thought comes whether there is any renal problem, whether there is any cardiac problem. These thoughts comes in our mind. But we generally overlook, is there any problem with nutrition? In old age, protein energy malnutrition is quite common, and that's why that protein energy malnutrition generally used to produce a lower edema on lower extremities commonly. So this should not be missed. There are many patients brought to you with different nutritional deficiencies, which we never understand. In fact, for that purpose only the PSM subject is there. If you read it by heart, then you will understand it. It plays a very vital role in your knowledge. It gives a lot of things. So third thing, you have to find it out whether is there any malnutrition. The fourth point, is there any history of injury? This is too important. Sometimes you get the case with a certain thing and you don't know whether he had the history of a trauma or injury. But it is too much necessary. Sometimes that gives you a right remedy, that gives you a hint to find it out what may be. A child was brought to me. It was a way back again, 10 years back. The child was brought to me and that child was having a mental aberration. He was talking irrelevantly. And the child was brought, he was said, they were said what he is behaving in such a manner he never used to. And in last 8 to 10 days, he is talking like this. So as I took whole history, I discussed each and every point. But they said nothing has happened, sir. Everything. Then I asked that child. Child was not talking relevantly, but still I tried my level best to ask him whether you have got anything, any history of injury, whether you have fallen, anything. And then he told, yes, I fall down from the cycle and I got the head injury. Then the parents asked, you have not told. He said, no. But considering that history of a trauma to the head causing the psychological effect at the mental aberration, the remedy was very clear. Natrum sulf was given. And natrum sulf worked beautifully. Within 15 days, he was absolutely normal after giving natrum sulf to that child. So sometimes you have to find it out exactly what may be the cause, what type of disease it is. So injuries. Then foreign bodies. This is again too important. What the patient is suffering from. Whether the patient is having any foreign body inside the eye. This is too important. Patient is coming to you with severe lacrimation, watering from the eyes, and patient is just discharging and rubbing the eye. You can find it out remedy, and you find it out, yes, this is the remedy, this is the euphrasia. But you never take a torch and look inside the patient's eye to find it out, is there any foreign body? And if there is a foreign body, it is necessary to remove that foreign body, because that foreign body becomes a maintaining cause in order to tackle that disorder. So if there is any foreign body, it is your duty to remove the foreign body, not to give a dynamic medicine. This is too important. Traumatic and infectious inflammation. So inflammations, with the inflammations, when patient comes to you, whether it is traumatic inflammation or whether it is infective inflammation, but you have to understand what exactly it is. Sometimes traumatic inflammations are there. There are many remedies in your materia medica, but according to type of injury and type of inflammation, you have to think about the remedy. A child was brought to me with injury to the eye, and that he was rubbing eye with his fist, and it was a blunt injury. And that at that time you have to understand that it is not arnica will going to work, but whenever there is any injury to the eyeball after a trauma, after a blunt trauma, the symphytum plays a very vital role. So what type of trauma is there, and what type of inflammation, where that inflammation is there, where that injury is there, that you have to look for. Then he says the infectious inflammations. Infection plays a very vital role. Even though it has been said that infection is a prima causa morbi, but still we have to understand the pathological things. We have to understand, we have to go with the modern way. We have to understand, we must ask the patient to go for investigation. It is important because sometimes if we don't get anything in symptomatology, we can treat according to that also. There was a case which I have seen in my friend's hospital in Sangamner. He asked me that patient is in agony. Patient was in fact, patient is in semi-comatose state, and She is having severe fever with chills, rigors. Everything found normal. Only the urine contains many percent. Tremendous. And she is on already double antibiotics. Nothing is working. Since 3 days we are giving IV antibiotics, it is not working. So what to do? Is there any homeopathic remedy which you can prescribe? Yes, I said yes. Why not to? Then I prescribed only on this single symptom because there was no history, nothing I have got. So there was a pus in urine. That was the very important thing. So remedy I got is the Uha Ursi. Uha Ursi is the remedy in your Materia Medica. Read that remedy. It is the remedy where it has been written that urine contains pus, red RBCs. It is pathological symptom of Uha Ursi, and it is the remedy I have tried many times without fail. So we can think about the things when we think logically. This is what James Krauss is saying, Hahnemann is saying. This is the way with which we have to look for in the patient. We don't have to look for just in the simple manner. Yes, the patient comes, he tells you symptoms, you find it out totality and you give the remedy. This is not, you have to utilize your logic, and this, how to utilize logic, that process is defined by the James Krauss. This is what is the ideal logic. This is what the scientific logic, which he is explaining over there. How to think whenever a patient enters in your clinic. See, very perfect aspect he has explained. One more point which he has explained over there, new formation is affected. New formation. What is new formation? There are many patients who comes to you with osteoarthritic knees, and they labels there is a osteophytes, and osteophyte is called as newborn formation. Actually, it is not. It is an outgrowth because of the just rubbing one bone on the another, and that osteophyte develops. If this type of exhaustus develops, if such type of degeneration develops, we have a remedy. The modern science never have a remedy to remove that exhaustus. But in our Materia Medica, we can treat those such types of exhaustuses, which treat those such types of osteophytes with the help of a calcarea fluor, which plays very vital role in such types of cases and removes that. So see, logically we can think when we understand the patient, and for that purpose, how to understand the logic, the diagnosis, how it is important, that James Krauss is explaining. And he explains that if you understand all those processes, then you decide whether the patient requires medical treatment, whether the patient requires surgical treatment, whether patient requires hygienic treatment, or whether patient requires all of these together. Then the question of a logic regarding the homeopathic management comes. But prior to it, you have to decide, you have to understand the patient. This is what is called as knowledge of disease, and this is what Hahnemann says in third aphorism. One must know the knowledge of disease, followed by comma and followed by indication. And understanding of the disease knowledge is very essential in order to manage that case. And for that purpose, James Krauss also hints this thing in his introduction. We are going very slowly, but we have to understand all those things, my dear friend. This is what is needed. This is what is needed. This is what is the practical aspect of understanding the organ. And if we understand it, then we can go in with right logic when we deal with the patient. So, my dear friends, I think the time is up. Just 3 minutes are there. There were few questions. Rutuja asked, what potency did you give? The potency, which patient I have discussed, regarding which patient? Rutuja, which patient I have told about which you have asked potency? You can open your mic also and you can talk. Natural self was given in one impotency because the need was there at the specific, at the mental level, at the brain level, and that's why it is very important. 1M, natrum self was 1M, it was given. And for malformation, that is the hypoplastic uterus, I have started with the 30, and I have increased every month, 30, then 200, then 1M. I have utilized that. So remedy, I could not recollect. It was way back. In fact, it was way back. So I could not recollect the remedy, but I know the patient personally because she was the wife of a Chancy doctor.
Sir, I need to ask that after discussing all this, I have understood that with Organon, knowledge of complete reading of Materia Medica is also required.
Yes, definitely.
Honestly, in during exams, we have read only the superficial part of Materia Medica. So,
Yes.
can you guide us with how to study Materia Medica?
In which year you are?
Sir, I have completed my final year.
You have completed your final year. Okay. Basically, I want to suggest you that you read first the Allen's keynotes sentence by sentence. Every word is important. The way we are learning the Organon, in the similar manner, you have to learn the Materia Medica also. You open the Allen's keynotes, start with the first remedy, with the first sentence. First, understand what he wants to explain through that sentence. My suggestion is that if you want to learn the Materia Medica, go with our YouTube channel, the Divine School of Homeopathy. Materia Medica session is there, and many remedies have been mentioned. Some remedies are mentioned from Allen's keynotes. Go through that and how I have explained those. Those you must read, then you will understand regarding it. So tomorrow also we'll meet and ask your friends to come and join together this good activity. This is very important to learn homeopathy in this manner. So my suggestion, ask your friends to join our activity. Thank you very much. Just time is short. Tomorrow we'll meet at the same time. Thank you.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Yes. Thank you.
Sir, here, sir, a very short question. Here in Karachi, LM potency is not much available.